Okay, guys, let's get started. Good afternoon and happy Monday. Thank you all for joining us again. My name is Felicia Sprague. I am a regional manager at Whitehouse Dental, overseeing multi-site operations in Toronto. I am also a seasoned manager known for my focus on strong leadership, operational excellence, and prioritizing mental health. I am dedicated to shaping a workplace culture grounded in communication, innovation, and a patient-centered care.
Hi everyone, thanks for joining us today. I'm Dr. Aisling Whitaker. I'm a dentist and clinic owner in Toronto also. Before earning my dental degree, I completed a PhD in psychology, and I've spent more than 15 years consulting with dental clinics and speaking at conferences on marketing, team culture, and practice systems. I'm a faculty member of Clearly Aligned, a comprehensive clear aligner education platform. Felicia and I are the co-founders of Dental Hive, an app for finding dental jobs and hiring dental team members. And we created Dental Hive to help clinics on the pain points of hiring, HR, and employee retention. We are recording today's session, so please keep your cameras off if you're more comfortable with that. It will be hosted on YouTube. And we would love if you mentioned in the chat where you are watching us from.
So today's topic is so important to both Ashling and I. We will be discussing team wellness and mental health and strategies that we've implemented in our clinics to help support our team. We'll be chatting for about 30 minutes and sharing tools that you can start using in your clinic right away.
Whether you're joining us live or on the recording, please just grab a coffee, a snack, and we're going to jump in. So let's go.
So, why are we talking about mental health and wellness? Well, as dental professionals, and just as working professionals, we spend most of our time with our coworkers than our families. So, how we feel at work has such a big impact on our overall wellness. As the dentist or the office manager, we are the leaders of our team, and we have the ability to set the tone at the clinic and move the needle in terms of how our clinic runs and how our team is feeling. So, being able to gauge the wellness temperature of our team can help us stay ahead of burnout and, most importantly, team turnover.
So we're going to share four of our top tips to help improve your team wellness today. Tip number one is one of my favorites, and it is planning blockout times. So we're coming to the end of the year now, and it's the perfect time to plan all of next year. I want you to look at your whole calendar and block off time that the clinic will be on holidays. So that might be long weekends, it may be, the winter holidays, vacations of any of your main providers, conferences that you know are coming up that you plan to attend, and also start to schedule team meetings, whether those are group meetings or one-on-ones, and also team building, team training. So we, at this time point, ask all of our providers, our dentists and our hygienists, well, honestly, all of the team, do they know of any weddings that they have coming up next year? Do they know of any vacations specifically that they want or big events that they're hoping to take time off for? It's so surprising how people tend to tell you these things like a few weeks beforehand, even though they probably got the date, 6 months or more ahead of time. So try and block off anything that is very especially patient scheduling time, block it off ahead of time. If you're not quite sure what those dates are exactly, but you know roughly the month that they want, block off that week so that you have wiggle room. So, say for example, if I'm like, I like to take a week off in August, maybe the last week, maybe it's the second last week, I'll block that off now so that even if I have patients book the prior week to that, we can easily shuffle them across. There's nothing worse than having a week of hygiene patients booked that you have to move and nowhere to move them. It's very stressful for everybody, the patient, the reception team, like the hygienists themselves. We found that for a long time, our hygiene team were not taking appropriate vacation, and our dentists, like including myself, in the startup years. So it's really important to start to block that. It is a very important part of your career is to take time away from your office.
Rest is productive.
Yeah, exactly. Um, I know that we're not earning when we're at work if we are the dentist, but I like to think of my year as an 11-month working year to account for a month that's not all vacation, but it's vacation or education time or whatever combined together. And then I'm stopped thinking about like lost production. For education, a lot of your bigger providers will know what the courses are that are coming up next year, or you can ask them, "Hey, listen, by the end of this year, can you send me the dates of what education you think you're going to be signing up for next year, so that you can have all of that organized." Also, if the dentist or the hygienist is doing a major course, like a weekend course or whatever, and if the team aren't going to that course, I like to have like a half a day in very close proximity to a course like that that's already blocked off to regroup, build systems, have a huddle together and decide how are we integrating this into the office? What did they learn? How can we implement this? So we can fill each other in and create new protocols and systems. There's nothing worse than a dentist or a main hygienist going off and learning about something. Maybe it's laser, and then you've no plans for how you're going to integrate that into the office, and then that education is just lost. So block off your appointment schedule, and then kind of linking in with this, when you have all of that and you know what office closures there are, you can update your Google Business Listing up to a year in advance. So you can clear out old Google Business Listing vacation shifts that are closed off. You can update that for the whole next year. You could even go as far as setting up your out of office reminders for your emails.
Yeah, that's a great tip. Tip number two for us is setting clear communication boundaries. As the leaders of the team, we also need to be careful that we're adhering to these boundaries as well. So, first thing that we should do is create a detailed communication policy that outlines the specifics of how you want communication to go in your clinic. And I'll share with you a little template in a few minutes as well to get you started. But some examples of this are using a separate texting app so that work communication is separate from personal communication. We really like Signal. It's very, there's a lot of privacy around it, which is great, especially if you're sharing like the schedule or anything like that. But we always do that in HIPAA mode, which is amazing. But you can create different groupings for specific teams or topics. As you can see here, we have our offices in different groups. We have one group just for announcements that the managers can share different announcements and everything like that. We have a fun chat, so we can share, what people are up to on the weekend and everything like that. So it's really great just having those different groups so that you can do different things in each of those. When you're not in the office, you can silence notifications for your out of office hours, and then you're not bombarded by work texts, which is absolutely the worst. You don't want that coming up on your phone when you're trying to spend time with your family or your friends or anything like that. The next thing to consider is what you would define as appropriate communication and specific time sensitive scenarios. For example, we implemented a right to disconnect policy in our office. So this is so that we are not contacting employees outside of their work hours. It's so important that unless it's an emergency, that their home time is their home time. We don't want to interrupt anyone at their home. And as a personal thing as well, like I said, we need to adhere to these boundaries as well. So if someone is messaging us outside of work hours as leaders, we need to set those boundaries also. And if it's not an emergency, we're not looking at it. We're not messaging them back. Again, if it's not an emergency. Another thing that we utilize is quiet time. So this is the first 30 minutes of the day, you're just getting into work. The last thing you kind of want to be is bombarded by like different conversations or different, I need this, I need that. So this first 30 minutes of the day is so important. It's a time where no one can interrupt anyone else. That means you can come to the clinic, you can get through your morning routine, prep for the huddle, your first patient, any urgent tasks that have come up. And then during this busy 30 minutes, everyone's hustling. So it's so disruptive if you're kind of like interrupting to ask non-sensitive questions or just a chit chat. So to help you with the communication boundaries, right now I'm going to share communication policy and our right to disconnect in the chat. And then also these are in our Dental Hive app as well under the resources, and they're all printable. Perfect. There you go.
So these are really great documents to help get you started. We have lots of documents like this in our resource section that are all free. So if you aren't part of Dental Hive yet, please do download it. There's a lot of PDFs in there, and we're always updating them. And the purpose of these is, not necessarily that you can use them as is, but you can also modify them and help brainstorm with the leaders in your office to decide, what works for you. So, tip number three is to get feedback from your team. So many dentists that I talk to at conferences and meetings are fearful to hear feedback from the team. Um, you know, they're not sure what you're going to say. But I find it insightful to know the thoughts of my team. I have to have a tough skin. I'm a business owner, and I want to include my team in the decision making of the office. Um, I do find it very important to receive feedback at specific times. So, like Felicia said, we have our 30-minute do not disturb at the beginning of the day. But for me personally, I also find my deep clinical days to be very difficult times for me to receive feedback. So, what works for me in my team is to receive feedback surveys so I can sit down and take time to look through them, or also to have I have like a little digital post-it list where people can add things to it or suggestions to it, so I can group those together and digest them at a time that I'm able to hear that information. That way, I'm putting value on the information and feedback that my team are giving me. I'm not saying no, I don't want to hear that, but I actually personally find it very difficult to hear that on my clinical days. So I like to have kind of that allocated time. Some dentists even do like office hours at a specific time, or maybe they allocate an hour a week to gather all the feedback and look through it together. But it is important so that, as the manager, as the dentist, that you understand how do you like to receive feedback, and how are you going to manage the feedback that your team give you? Because when people are giving you feedback, it is a gift. They are taking the time out of their day to provide you with that feedback. It is usually constructive, and it helps your business grow. So, one way that we receive feedback at our offices is with employee wellness surveys. This feedback specifically is on how are my team feeling overall about management, their workload, and areas that they need support. So Felicia is sharing a copy of this survey in the chat for you to check out. And this survey specifically we do anonymously, so that people are honest. You could send this out to all of your team today and say, hey, fill this, like, or print a stack of them, leave them in Steri and say, I want everybody to fill this out for me by tomorrow, anonymously, and just leave it face down on my desk. I want a chance to get to know the team, how they're feeling. Some of it might be brutal, some of it will be really positive. Like I said, as an owner,
The balance.
it's a balance, right? You
The
have to have thick
balance.
skin, but anyone who's willing to write something on paper, I think it's worth listening to. And this has been a
Absolutely.
great way for us to really build our clinics up over time, and build that great patient experience and team retention, because they know we actually care about what they have to say.
Absolutely. And it's just so important that you do work on the culture in the clinic, which is tip number four, team appreciation. So one thing that we implemented was a solid plan for team appreciation. And if you do want more about appreciation, team retention, we did a webinar about this already, so you can get even more goodies if you look on YouTube for a past webinar. But one thing we did talk about was having an employee preference survey when team members start, so that we can get a sense of not only how the individual learns, but also how do they like to be appreciated. A lot of people think that it's just financial. People only care about money. But we found that so many of our employees, they all have different love languages. And two big ones that are among our clinic are verbal appreciation. So, we do shout outs on Fridays to kind of like verbally appreciate everyone in our clinic, and different things that some of our staff are doing, which is great. And then also professional development. So it's important to look at what are you offering, all of your employees in your clinic, what kind of education, what kind of training are you giving them? We have a great platform where we're always sharing educational videos or training videos. So that's just like one little way that you can help a team grow if professional development is their love language. A successful tool that we use regularly is a team appreciation survey. So I'm going to share both the employee preferences and the team appreciation surveys in the chat as well. But this survey gives an opportunity to shout out within the team, little thank yous and words of appreciation. And I think this is really special because it's not coming from you as a leader. It's coming from people you work with every day. So it's coming from, a hygienist that noticed something amazing that you did, or it's coming from the assistant that really appreciated, you as a receptionist bringing a patient in the room for them. Like people notice the little ways that you show teamwork at the office or the little things you do. And then this survey really gives them a chance to kind of shout you out. And then, we can say all the amazing things that your coworkers are saying about you. So I really love that survey. I really love messaging our team back with that feedback. It's so great. So I will share that in the chat. And then we also at our office have a little appreciation budget, which, is used for treats or gifts throughout the year, just little tokens to remind the team that we're thinking about them. And it's just something nice, they just like get to work one day and there's a little handwritten thank you card and like a package of their favorite chocolate or like a bag of their favorite gummies and something that isn't too expensive, but it goes such a long way with our team. Just those little thank yous and those little nods of appreciation.
I think one of the nice things that Felicia implemented in regards to that was she came to me and said, look, I want to have a budget each year for team appreciation. So let's sit down and write this all out. Let's know what are we gifting at Christmas? What are our tokens throughout the year? What's our budget for education for each team member? Do we have a budget or are we, very lean this year? Like, what's that looking like? And kind
Yeah.
of having that as a guide for us to look back on and see, like, where are we at with each of these things and having a system so that people don't get forgotten, which can
Yeah.
happen easily when you have a team of 30 people. There's a birthday twice a month in our office.
Yeah.
Just getting all of that really clearly written out for the upcoming year. um, what does that look like? And when it comes to education, maybe the budget is lower, but one thing we did in our hygiene team one year was we did a book club for the year. So I bought all of them a copy of a very specific book that I wanted them to read. And then we sat down on a Zoom and like all chatted about it together one evening, and paid them for that time. And I think like little things like that, whether it's having the opportunity to go to a course, that's amazing if that's in the budget, or whether it's sitting down and reading a few specific articles together that are clinical, or Felicia created a little library for our team of books that have really been meaningful in her life, for people to read and leave there and take home and share and that kind of thing. These are all ways to show that uh, you love your team and you
Absolutely.
appreciate your team and how important they are in your day-to-day life, because they are your work family.
And I will say, having like sitting down and actually doing a budget, we know between managers and owners, it gives your manager such amazing leeway and trust that they can like go and implement that without having to ask the owner for every little thing, which is so important, like I don't want to have to go to Ashling like every month and be like, hey, it's employee appreciation. How much can I have to like give to each employee for a gift? We have a budget set out. I have certain times of the year where I'm like, okay, I'm gonna do a little special gift here. We have employee appreciation here, so on and so on. So it's great that I have a guideline for myself, and I one thing I can take off of her plate, and it feels makes me feel really good to be able to show the staff appreciation. So that's something I really appreciate. Oh, Ashling, and just the way that we work together. And I will say, wellness is so important. Not a lot of people know, but a couple years ago, I was extremely sick. Like my appendix burst. I was out of the work for about 3 months. I was in the hospital. And like I messaged Ashling and I was like, you can replace me. You can like find someone else to take over. Like it's not a problem. I totally understand. And she's like, Felicia, we are in this for the long game. And that was so meaningful to me, just that like, we see our coworkers as our family. And I think that like that's so important is if you don't see them as family, then you're not doing something right. Like you really have to treat each other with respect and with care and care about their wellness because you are together for so long during the day. So, showing care, especially during these winter months, is just like really important.
That's so sweet, Felicia. I'm sorry if you'll hear my dog barking. And another part of it for me is that, being the office manager or the clinic owner, it's often lonely at the top. That's why we love having these meetings where office managers join us because we understand that. We want to provide you with support, but we also understand that a lot of the time the management, we don't have support necessarily, right? We're out there being the leaders, and we often have to um, retrain people and sometimes give people critical feedback that could be quite difficult to give. And I think a number of years ago, we were both feeling like, man, we're always kind of correcting people on things and always having to be the bad guy. And flipping this around to promoting wellness and promoting well-being and having a lot of strategies to implement the positive has been beneficial to both of us also.
Absolutely.
Like Felicia was saying, she gives her Friday shout outs, and little words of wisdom. And I think the impact on us, the positivity impact on us on the management level has been very strong doing these things too. So I asked Felicia the other day because we don't even get to see each other that much. That's often
No.
the case. The management aren't even talking to each other all that much. And she said, I don't know about you guys, but I am thriving this year. And I thought, wow, like that is so amazing how you can go from having a position that is often a thankless position and to have a position where you're still in that position of power, but you're switching it around to like a position of leadership and positivity, which is a really
Absolutely.
amazing place to be. So Felicia and I really believe that you have the power to live and lead a more stress-free life. And as the leaders, that we have kind of the responsibility to be living that life and showing that to our team. So there you have it. Four easy practical tips you can start today. Blocking off time, important one for me because I used to really struggle to take vacations. Communication boundaries, feedback, wellness feedback, team appreciation. We hope that you found this helpful and you learned some pearls. We keep this short and sweet so that you can fit it into your day and really take away some actionable steps right away. We're always working on this for our clinics and we're always making changes every year. And our goal is that we can each work in a clinic that we feel like we have a positive work life and this lower stress can overflow into our home life.
Yeah. And if you enjoyed this webinar, we hope you join us again in the new year where we will be talking about goal setting for the clinic. So we're going to be live once again on Zoom on Monday, January the 5th at 12 p.m. Eastern Standard Time. So happy holidays, and we will see you all then. Thank
See you
you.
then.